A fifth of the Australian population is back under strict lockdown this morning, with stage 3 restrictions now in place across Melbourne and a regional council to its north. Just weeks after parts of the Victorian economy started to emerge from hibernation, businesses have had to either close or drastically change the way they operate.
The military has been brought in to help control movement in and out of lockdown areas. This morning, there were 134 new coronavirus cases in Victoria yesterday, with aged care homes and several hospitals also recording infections among staff. We'll be speaking to Federal Health Minister Greg Hunt in a few minutes. But first, let's take you to the streets of Melbourne, and Zali Rismal is outside one of those towers we've been watching very closely for the past few days. Zali, tell us about this lockdown in metropolitan Melbourne.
Well, as of midnight last night, more than 5 million Victorians back in stage 3 restrictions. It's the first day of 6 weeks of this lockdown, with Melburnians once again only able to leave their homes for one of those 4 reasons. But we saw last night in Melbourne quite busy scenes with people taking the last opportunity to get out and about. Here is what some of them had to say about the prospect of going back into lockdown.
Oh, I think it's something that needs to be done. Unfortunately, we seem to be out of control compared to the rest of Australia, so in the best interest of everyone, that's the right thing to do. As much as it's going to hurt a lot of people, it just needs to be done.
I think I've been okay. I think obviously being pregnant, to be honest, I think it's worked in favour for me the whole time because I've got to work from home the entire time.
I think it's a pretty uneasy and nerve-wracking time for everybody. You know, our family's been lucky. We're healthy and happy and have our jobs, but many people don't.
Now, Melburnians can expect a heavy police presence in these coming weeks, with police erecting roadblocks right around the boundaries of the city. Yesterday, the police minister warned that fines will form a central role in enforcing compliance and making sure that people do the right thing. We also heard from the Chief Commissioner of Police, who said that that window of discretion that police were using in the last lockdown would be narrowing, with fines much more likely to be issued, and at $1,650 a pop. It's quite a hefty fine there. But of course, all of this is designed to stop the spread of this virus. We've seen a massive surge here in Victoria. Yesterday, another 134 new cases. We're now sitting at 860 active cases, with 450 of those suspected to be community transmission.
Zali, thank you very much for that. And we know that the testing is finished at those towers, so we wait for those results as well.
Right, OK. Well, for more on the situation in Victoria, Health Minister Greg Hunt joins me now from Melbourne. Good morning, Minister. Is this going to work, or do we have to prepare ourselves for lockdown 3.0?
Well, we are very focused on making sure that this is an effective and successful program here in Victoria. We know this can work. 7 out of 8 states and territories, and Victoria until now, have had a dramatic outcome, a positive outcome. Now in Victoria, it is a difficult time for families in apartments and in flats, for small business owners, for employees. But we are going to do this because we have to do this to save lives. We can see that the number of people in hospitals and intensive care has grown. So this is a difficult but sadly necessary step, and the federal government is leaning in to support and to help Victoria and Victorians.
Right, and one of the things that the Victorian Premier asked for was to stop these international flights coming in. That's happening until July the 14th, but there's a suggestion it needs to go on for longer, and I understand National Cabinet is going to be looking at this issue tomorrow. What's the logistics of decreasing the number of people actually coming into Australia? How does that work?
Well, what we do is, of course, we work with each of the states and territories and then collectively on the total capacity for the hotel quarantine system and the quality of it. In 7 out of 8 states, it's worked extraordinarily well. It's detected well over 400 cases incoming, prevented them from going out into the community, kept those individuals safe and kept the community safe. Clear, significant breaches in Victoria, as have been acknowledged by the Premier. And so, as a consequence of that, What the National Cabinet is doing is reviewing the total numbers to make sure that the procedures are safe. As I say, 7 out of 8 states and territories have done an extraordinary job, and then that will moderate the number of total flights and therefore the number of people that come into Australia.
So people could wait for another month or so if they were trying to get back into Australia. They'd just have to wait it out.
These are all difficult decisions, and we have brought approximately 70,000 people through the hotel quarantine system. We've brought Australians home, but we have to work to the safe capacity of each of the states and territories. That's the fundamental responsibility, and for Australians who are coming home now, 5 months after the virus first started, then obviously each will have their own circumstances, and if they do have to wait, we'd ask them to be patient.
Gee, that Jetstar case in Sydney was a bit of a blunder, wasn't it? That'd have to worry you about what's ahead.
So even though it's being carried out as a domestic transfer between the states, I instructed my department to immediately approach the states to work on the procedures. I've been reassured that they have not only begun and either in almost every case or those still to come carried out the contact with the individuals, but that New South Wales has changed its procedures. So we saw that there was one case here in terms of one flight. We have provided federal oversight immediately, and to New South Wales' credit, they've responded immediately.
Would you back the New South Wales Premier in moves to tighten restrictions in that state? She seems to be indicating that's ahead.
Well, always each Premier is using a containment and isolation model in consultation with the federal government, and that's about the needs with regards to the case levels. And so we have what we call rings of containment, where when there is an outbreak, whether it's in an aged care facility, whether it's in a business, or whether it's in a residential community, that capacity for localised containment is there. It's a model we established in February. It's played itself out in northwest Tasmania and worked very well. Now it's being used in particular areas of Melbourne, and then more broadly in Melbourne, and then at the borders to help isolate those within Victoria who may be at risk of passing on the virus. So we're using that model. We outlined it. We're prepared. And I do think it's important to provide this reassurance to Australians that we've done this once. Now, as a country, we have to focus on Victoria, which has to do it again, and it will be a difficult time, but we know how to do this. We know we can get through this, and we have to support each other.
All right, Minister, thanks for your time.
Thanks, Lisa.